My name is Sanna Gaspard, and I'm here today to tell you about a story of how growing up in an environment of scarcity cultivated a spirit of innovation, entrepreneurship, and inventorship. I was originally born in the Caribbean island of St. Lucia. It's a small, developing country where all the resources that you may need may not be readily available. If something is broken in your home, there's not necessarily, at the time when I was a child, a Home Depot that you can run to buy a part and fix it. There wasn't someone always that you could run to. You had to come up with your own solutions. If you wanted water, the options were going to the river and collecting it or creating a water collection system. If you were sick, there weren't always readily available medicines. So we turned to natural things. For example, if you were constipated, we would take Sennapods and make a tea out of it. Or we would use charcoal to whiten our teeth. Or dandelions to address inflammation. Growing up in such an environment created and cultivated a spirit of creativity, curiosity, problem identification, and the ability to do need-based solutions. This allowed me, at the age of 10, after we immigrated to America with my family, to find extraordinary things in the everyday problems. So one day, at around the age of 10, I was looking at a tomato and noticed that it had split. And I thought, how interesting, right? And it had also healed itself. A juicy, ripe tomato split, but did not drip. I thought, very curious. I wonder if the skin is similar to my skin. If I took a piece of tomato and put it on a cut, would it heal it? So the next time I had a cut, took a piece of the tomato and rubbed it on my cut. And it helped to seal the cut and healed it. I took the spirit of innovation and problem solving to the University of Miami, where I majored in biomedical engineering. This is where I came upon the first problem that would allow me to invent my first medical device. I came across a problem known as preterm infant deaths. So there are about 500,000 babies born every year, prematurely. The death rate for them could be as high as 55%. For me, I thought that was unacceptable because I had learned about a solution that could be used to help improve their survival rate by over 30%. It was a simple solution, purely infant massage. But it wasn't being used by hospitals because it was too expensive and it was too time-consuming. And I thought, I could solve this problem. The solution to this problem is simply automation. So I invented my first patented device called the Automated Infant Physiotherapy. What it does is basically automates the certified infant massage therapy process. It uses sensors to monitor the infant so that every infant gets a customized massage that is guaranteed to be effective. And it does this autonomously. After inventing this technology, I then went on to grad school to pursue my PhD in biomedical engineering from Carnegie Mellon, where I came across a second problem that I just thought was unacceptable and needed a solution. A problem that affects millions of people around the world and most likely has affected many family members of the people in here. Similar people to, for example, the Tassel family. So in 2007, Byron Tassel fell from his roof and was rushed to the hospital. While at the hospital, he developed a severe bedsore. It was so severe that the top layer of his skin was gone. The flesh underneath his skin was gone, and you could see all the way down to his bone. Byron would eventually die from complications of his bedsore, and his family were awarded $6.3 million in a wrongful death suit. Byron is just one of the 37 million Americans every year who are evaluated for a bedsore. 2.3 million will be diagnosed. 60,000 will die needlessly. This is because if you can detect the bedsore early, it can be prevented. But detecting it early is very difficult. At the earliest stages, it's just indicated by skin redness, which is very hard to detect. In addition, the early diagnostic test is over 100 years old. It's manual and it's unreliable. Further, you can't see it on darker skin tones. And you can have two people do the test and come up with two different answers. And you don't know who's right until it's too late and you have a large wound on your body, which could potentially kill you. This manual test is so unreliable that this preventable healthcare condition cost the US healthcare system $11 billion in 1 year alone. Assured that I had found a real problem that needed a solution, I went about reaching out to our potential users, nurses in hospitals and nursing homes, who confirmed that yes, this was a problem for them that they battled every day, and they were looking for a solution. The problems they identified was that the test was just too unreliable, it had too much variability, 2 people could do the test, you get different answers, it was difficult to monitor incremental changes to know how to adjust the care of the patient, and it did not work on darker skin tones, independent of race, whether you were from Africa, from India, from Asia, or South American. It just was difficult to see that skin redness on colored skin tones. Because we wanted to focus on making sure that the technology also had impact, I not only wanted to know what problems that they had with the detection, I wanted to know what were the real needs that they had to make this invention impactful. So the problems that the needs that they identified, the needs they identified to use the technology was that even if it worked, if it didn't meet these needs, they would not use it. It had to be low cost, it had to be easy to use, and clean and easy to store. Otherwise, they just wouldn't use it. With the technical needs identified and the user needs identified, we went about solving the solution. And I came up with the Rubitect assessment system. So it's essentially a handheld device that allows any user, whether you're a consumer here, a nurse, or a doctor, whether in a home care setting, a long-term care setting, a hospital, or a nursing home, or possibly a clinic in Africa, to do a skin assessment, to measure changes in the health of the skin, to detect the bedsore at its earliest stages when it can be effectively treated at a low cost. We've also coupled the system with a software app that allows any user to easily monitor changes in the skin, that they can either send that to the doctor to do telehealth, or if you were the caregiver yourself, you could customize your care plan to each individual patient. With this in mind, we had met most of the technical needs and the user needs, and we set about addressing the most difficult one, which was cost. To address this need, we had to compare our technology to the other technologies out there, and we made it a specific design requirement. If it was too expensive, if the part was too much, we did not use it. This allowed us to develop a solution that can have the highest impact. Not only did it meet the clinical user needs and technical needs for detection, but it was also low cost and easy to use. This allowed us to ensure that our invention would have impact. It would reach millions of nurses, hopefully, globally, that's our goal, to allow caregivers to deliver better patient care at a reduced cost to help save lives. So to date, I've already built an initial prototype. We've tested it and showed that the system works. I did this for my PhD work, and at that time, I had to make a decision. Do I continue this work, or do I walk away from it and go get a job with a larger company? Had I walked away from it, it would have sat as a patent in the tech transfer office of my university. And I thought to myself, if I'm really committed to having an impact and making sure that my invention has impact, I decided I needed to stick with it. So upon graduating, I launched Rubitection, which is a startup company to help commercialize the technology. We started working on clinical prototypes, as well as reaching out to clinical partners so that we could do testing and user feedback sessions to customize the device to make sure not only did it meet the technical needs, but it's also something they would want to buy and use. Also, put a plan together to getting this to market, something people don't always think about when they're doing invention. So if you're going to commercialize it, you need to understand what are the steps that you need to take to get it there. And we had to outline that because it's an important step in getting the financing you need to bring your system to the market. So we're going to focus on testing before going on to product development, and then moving on to making relationships with strategic sales and distribution partners. We also put a team together to help us get this to market. As someone in the conference said, innovation or inventionship does not happen solo anymore. So to really get impact, you can invent something in your mind, but if you really want to put it in the hands of users, you need a team behind you. So with this team, we were dedicated to solving this problem because no one should have to die from a bedsore. It's preventable. And so we were focused on having this impact. And so that you know, in conclusion, the ability to solve problems and have inventions that have impact goes back to my childhood. We grew up in an environment where you did not have all the resources you need. But we grew up in an environment where identifying problems and coming up with creative solutions to them was vital to our survival. If you did not know how to get water and purify it, you would get sick. If there's no medicine, you would potentially die. And then this has become part of my DNA and carried me through my life, and education has allowed me, without a robotics background, to identify the problem here, to come up with an autonomous robot for delivering a life-saving therapy, all the way to developing optical diagnostic devices for a common healthcare problem. This environment and the impact it can have on creating inventors is so prevalent and strong that 20, 25 years later, I'm proud to say that my cousin, who still lives in the Caribbean, came up to me recently and said, "I have an invention." And I said, "What?" I said, "No way." And I said, what's your invention? She said, "I've come up with a new ant killer." And I said, "Really? Tell me about it." She said, "It includes alcohol. She's combined alcohol. She's combined glue. She added color she's a girly girl, so she added colors to make it pretty. And then she added her secret ingredient." And I said, "What is your secret ingredient?" Funny enough, it's cockroach spray. I did not want to bust her bubble, so I said, "Good job. I'm waiting to hear about your next invention because I want to cultivate that spirit." And I can see, even though technology has advanced on our island, everyone has, flat screen TVs now, and there is a hardware shop now that you can go to get parts. The spirit of problem solving and innovation and entrepreneurship is still there. That my 8-year-old cousin has invented ant killer spray. The other major point that I would like to say is that coming from an environment where I learned to identify problems and I learned to come up with creative solutions was only half of the battle. What really allowed me to bring these inventions out and make sure they have impact was combining that skill set with the resources of my universities. As a child, I had always had an inventive mind, but I had no resources to build it, to get a patent, to do anything. I didn't have that opportunity until I came to the university and had access to the labs, had access to the tech transfer office, had an opportunity to learn how to commercialize it and take it out. And so my last words to you is that anybody can be an inventor. You just need to know how to identify problems and have the desire to come up with a solution. And added that to the resources of a university and knowing how to manage that and when to take it out of the university, we can have an abundance of inventors who are coming up with impactful solutions that really help society from improving our day-to-day lives to saving lives. So thank you.